A 24-year-old male shows up with neck pain and trouble speaking. Definitely concerning. As I look at the initial non-contrast CT, the first thing that jumps out at me is the hyperdense appearance of the right middle cerebral artery. That's what we call the dense MCA sign, and it's practically waving at me saying, "Hey, there's a thrombus here." A blood clot in this area could spell trouble, cutting off critical blood supply to part of the brain. Then, scanning through the rest of the unenhanced CT, I notice subtle areas of low density in the right caudate and lentiform nuclei. That's where the damage is happening. These areas are starved of oxygen, and it's just the beginning of what looks like an acute infarct. But to be absolutely sure, I turn to the MRI, which is always great for giving us more details. The T2-weighted MRI shows clear hyperintensity in those exact same areas of the right caudate and lentiform nuclei, confirming what we suspected. We're dealing with an acute infarct here. Then, the diffusion-weighted imaging, or DWI, really seals the deal, showing the hyperintensity in the same regions. It's telling me this is fresh, a hyperacute infarction, no doubt. But there's more. I look at the T2-weighted MRI of the internal carotid artery, and bam, I see it. The right ICA looks narrowed, and it's surrounded by this crescent-shaped hyperintensity. That's the telltale sign of a carotid artery dissection. This narrowing and the clot that formed because of it are what's led to the right MCA territory stroke. So this young guy, just 24 years old, has suffered a right ICA dissection, leading to a thrombus in the MCA and causing this stroke. It's not something you see every day in someone this young, which makes carotid dissections something you've got to consider in these cases. Managing this situation? Time is brain. I'd be contacting the stroke team immediately to get anticoagulation going, something like heparin or an antiplatelet agent to prevent further clots. We'd also need more imaging, maybe a CT angiography or an MR angiography, to get a closer look at that dissection and ensure we're fully on top of it. When you think about stroke in young adults, arterial dissection is a prime suspect. It's often linked to trauma, though even something minor like a sudden neck movement could cause it. Or in some cases, the patient might have an underlying condition like Ehlers-Danlos or fibromuscular dysplasia, both of which make their arteries more prone to tearing. Dissections like this can present with neck pain, headache, and maybe even a partial Horner's syndrome. That's when you get a droopy eyelid, a constricted pupil, and less sweating on one side of the face. If you see that in someone, it's time to think dissection. The narrowing of the vessel can usually be seen on MRI, and you might even catch that characteristic crescent-shaped sign, as I did. Treatment here is all about stopping further clots from forming and managing the dissection. Anticoagulation is key, and depending on how things go, we'd keep a close eye on whether surgery or endovascular treatment is needed down the line. So, there we have it. A dense MCA sign, acute right MCA territory infarct, and a right ICA dissection. Every one of these clues tells the story of this case, and now it's all about managing the situation to avoid further damage. That's a wrap on this case. If this breakdown helped you understand how to tackle complex radiology cases, make sure to subscribe for more. And hey, don't forget to comment below if you've got questions or your own thoughts on this one.